Hello everyone and welcome to our channel. We at Health is Priceless go to great lengths to produce all of our videos with sound and relevant information that truly applies to everyone. None of us are exempt from the concerns or conditions that we address. We do not believe in coincidences, and we feel that there is always a timely reason for viewers to connect with our videos. Before we get started, make sure to subscribe to our channel and leave a comment below saying, "I subscribed." We will do our best to reply as soon as possible. Thank you. The heart, a remarkable organ. The heart tirelessly pumps blood throughout our bodies, ensuring that every cell receives oxygen and nutrients vital for survival. Despite its incredible resilience, the heart is vulnerable to various conditions that can compromise its function. Heart disease remains the leading cause of death globally, affecting both men and women. While many risk factors for heart disease are well known, prevention strategies are often overlooked. This video delves into the critical aspects of heart health and explores preventative therapies tailored for both men and women. Understanding heart disease. Heart disease encompasses a range of conditions affecting the heart, including coronary artery disease, CAD, heart failure, arrhythmias, and valvular heart diseases. Among these, coronary artery disease is the most common, often resulting from atherosclerosis, a condition where the arteries become narrowed or blocked due to plaque buildup. This can lead to heart attacks, angina, chest pain, and other serious complications. While heart disease can affect anyone, certain risk factors make individuals more susceptible. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, sedentary lifestyle, and a family history of heart disease. Men and women share many of these risk factors, but some differ, necessitating gender-specific approaches to prevention. The gender divide in heart health. Historically, heart disease has been perceived as a predominantly male issue. However, this misconception has been debunked by research showing that heart disease is also the leading cause of death among women. Despite this, women often receive less attention regarding heart health, partly because their symptoms can differ from men's and may be less recognized. Men and heart disease. Risk factors. Men are more likely to develop heart disease earlier in life than women. This is partly due to higher levels of risk factors like smoking, high blood pressure, and cholesterol. Testosterone may also play a role, as it has been linked to an increased risk of hypertension and atherosclerosis. Symptoms. Men often experience the classic symptoms of a heart attack, such as chest pain, discomfort in the arms, back, neck, or jaw, shortness of breath, and sweating. These symptoms are usually more pronounced and prompt quicker medical attention. Women and heart disease. Risk factors. Women tend to develop heart disease later in life, often after menopause, when estrogen levels decline. This hormone is thought to have a protective effect on the cardiovascular system. Risk factors unique to women include pregnancy-related conditions like preeclampsia, gestational diabetes, and hypertension. Additionally, autoimmune diseases, more common in women, can increase heart disease risk. Symptoms. Women's heart attack symptoms can be more subtle and less typical than men's. They may include fatigue, nausea, shortness of breath, indigestion, and discomfort in the neck, jaw, or back. These atypical symptoms often lead to delayed diagnosis and treatment. Given these differences, it's crucial to adopt preventative strategies that address the specific needs of both men and women. Preventative therapies for heart health. Preventing heart disease involves a multifaceted approach that includes lifestyle modifications, medical interventions, and regular monitoring. While these strategies apply to everyone, certain therapies may be more effective for men or women based on their unique risk profiles. Lifestyle modifications. The foundation of heart disease prevention lies in making healthy lifestyle choices. These modifications are universally beneficial, but may have different impacts based on gender. Healthy diet. A heart-healthy diet is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Reducing intake of saturated fats, trans fats, cholesterol, sodium, and added sugars is essential. The Mediterranean diet, which emphasizes these elements, has been shown to reduce heart disease risk in both men and women. Physical activity. Regular exercise strengthens the heart, improves circulation, and helps maintain a healthy weight. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity, or 75 minutes of vigorous activity per week, plus muscle-strengthening exercises. 2. Both men and women benefit from physical activity, but women, in particular, should focus on weight-bearing exercises to protect against osteoporosis, which can indirectly impact heart health. Smoking cessation. Smoking is a major risk factor for heart disease, and quitting is one of the most effective ways to reduce risk. Men are more likely to smoke than women, but smoking rates among women are increasing in some regions, making cessation efforts crucial for both genders. Stress management. Chronic stress can lead to high blood pressure and other cardiovascular problems. Techniques such as mindfulness, meditation, yoga, and deep breathing can help manage stress. Women, who are often more affected by stress due to caregiving roles and multitasking, may particularly benefit from these practices. Healthy weight. Maintaining a healthy weight is vital for heart health. Obesity increases the risk of heart disease, and weight loss through diet and exercise can significantly reduce this risk. Men typically carry excess weight around the abdomen, apple-shaped, which is more harmful to heart health, while women tend to accumulate weight around the hips and thighs, pear-shaped. Both patterns carry risks, but abdominal fat is particularly dangerous. Medical interventions. For individuals with existing risk factors, or those who have experienced heart problems, medical interventions are often necessary to prevent further complications. Blood pressure management. Hypertension is a significant risk factor for heart disease, and managing it is crucial. Both men and women should have their blood pressure checked regularly. Medications like ACE inhibitors, beta blockers, diuretics, and calcium channel blockers are commonly prescribed to control high blood pressure. Women should be aware that hormonal changes during menopause can increase blood pressure, necessitating more vigilant monitoring. Cholesterol management. High cholesterol levels contribute to plaque buildup in the arteries, leading to atherosclerosis. Statins are commonly prescribed to lower cholesterol and are effective in both men and women. However, women may experience more side effects from statins, so discussing options with a healthcare provider is important. Aspirin therapy. Low-dose aspirin is often recommended for individuals at high risk of heart disease, as it can prevent blood clots. However, aspirin therapy is not suitable for everyone, and its use should be based on individual risk factors. Women, particularly those over 65, may benefit from aspirin therapy, but it should be used with caution due to the risk of gastrointestinal bleeding. Diabetes management. Diabetes significantly increases the risk of heart disease, especially in women. Managing blood sugar levels through diet, exercise, and medication is critical. Both men and women with diabetes should work closely with their healthcare provider to monitor their heart health. Regular monitoring and screening. Early detection of heart disease and its risk factors can prevent serious complications. Regular monitoring and screening are essential components of preventative care. Blood pressure checks. Regular blood pressure checks can detect hypertension early, allowing for timely intervention. Men, who are more likely to develop high blood pressure at a younger age, should start monitoring earlier, while women should be vigilant, especially after menopause. Cholesterol testing. Cholesterol levels should be checked regularly, starting at age 20, with more frequent testing if there are additional risk factors. Women should be aware that their cholesterol levels can fluctuate with hormonal changes, making regular testing important. Blood sugar testing. Regular blood sugar testing can help detect diabetes or prediabetes early. Women with a history of gestational diabetes or polycystic ovary syndrome, PCOS, should be particularly vigilant. Weight and body mass index, BMI. Monitoring weight and BMI can help assess heart disease risk. While BMI is a useful tool, it doesn't account for muscle mass or fat distribution, so it's important to consider waist circumference and overall body composition. Electrocardiogram, ECG, and stress tests. For individuals with symptoms of heart disease or those at high risk, an ECG or stress test can help assess heart function and detect any abnormalities. These tests are valuable for both men and women, especially those with a family history of heart disease. Gender-specific considerations. While many preventative strategies apply to both men and women, there are some gender-specific considerations that can enhance heart health. Women and hormone replacement therapy, HRT. The decline in estrogen levels during menopause can increase heart disease risk. Hormone replacement therapy was once widely used to manage menopausal symptoms and reduce heart disease risk, but studies have shown mixed results. HRT may increase the risk of blood clots and stroke, so it should be used cautiously and under the guidance of a healthcare provider. Pregnancy and heart health. Pregnancy-related conditions like preeclampsia, gestational diabetes, and hypertension increase the risk of heart disease later in life. Women who have experienced these conditions should be particularly vigilant about heart health and discuss their history with their healthcare provider. Men and testosterone therapy. Low testosterone levels in men have been associated with an increased risk of heart disease. Testosterone replacement therapy is sometimes used to address symptoms of low testosterone, but its impact on heart health is still being studied. Men considering testosterone therapy should discuss the potential risks and benefits with their healthcare provider. The role of education and awareness. Education and awareness are powerful tools in the fight against heart disease. Understanding the risk factors, symptoms, and preventative strategies can empower individuals to take control of their heart health. Heart health education programs. Community programs and online resources can provide valuable information on heart health. These programs should be tailored to address the specific needs of men and women, considering their unique risk factors and symptoms. Public health campaigns. Public health campaigns that promote heart health awareness can reach a wide audience and encourage individuals to make heart-healthy choices. Campaigns should highlight the importance of regular checkups, healthy eating, physical activity, and smoking cessation. Patient-doctor communication. Open communication between patients and healthcare providers is crucial for effective heart disease prevention. Patients should feel comfortable discussing their symptoms, concerns, and family history with their doctor. Healthcare providers should be proactive in educating patients about heart health and offering personalized prevention strategies. Conclusion. Heart disease remains a significant health threat for both men and women, but it is largely preventable through lifestyle modifications, such as exercise, nutrition, medical interventions, regular monitoring, and education. Understanding the unique risk factors and symptoms associated with each gender is essential for effective prevention. By adopting heart-healthy habits and working closely with healthcare providers, individuals can significantly reduce their risk of heart disease, improve wellness, and enjoy a longer, healthier life. Prevention is the best medicine when it comes to heart health and general well-being. Thank you for joining us in this guide to heart health. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you don't miss any of our future videos. Share your own heart health tips and experiences in the comments below. Until next time, remember, your health is priceless.